everyone, I'm Anastasia signing in from NORAS. In today's session, we will be dealing with a very important topic, that is the hot and cold application. Here, we will be discussing in detail about the principles, the therapeutic use, as well as the temperature of hot and cold application. As we know that application of hot and cold are commonly used in the hospital as well as at home as a therapeutic and comfort measure. Here it is very important that we must first have a thorough knowledge about the physiological effect as well as the untoward reaction which may occur by using these measures. Here, what do we mean by hot and cold application? Application of any agent that is warmer than the skin is known as the heat application, whereas application of any agent which is cooler than the surface of the skin is known as the cool application or the cold application. Both these applications can be provided either in a dry or moist form. Here, when we will be discussing about the heat as well as the cold application, there you will be getting a detailed idea of what are the ways through which a hot and cold application can be provided, as well as the two forms of the application, which is the moist and the dry form. Now let us discuss about the general principles of hot and cold application. As we know that heat is always passed from the cooler area to the hotter area. This heat is distributed throughout the body either by the circulating blood or even by the direct conduction throughout the tissue. The amount of heat lost from the body is related to the circulating blood, which is close to the surface of the skin. So here, this amount of blood that is circulating close to the surface of the skin is influenced by the vasoconstriction as well as the vasodilation of the peripheral arterioles. Here we must also remember that moisture conducts heat well than the air, and also that the ability of a person to tolerate a required or a provided temperature may be different from one person to the other. Here, as we know that the younger ones, that is the children as well as the older adults, are more sensitive to cold and heat. So here the temperature tolerance, the ability of one to tolerate temperature may vary depending on their condition as well as depending on their age. And also a person will become less sensitive towards the heat or towards the cold if this hot and cold application has been repeatedly provided. because here the length of time that the person is exposed to that extreme temperature will affect the body tolerance towards the temperature. And as a nurse, it is also our responsibility that we must assess the condition of the patient before, during, as well as after the application has been provided. We should make sure that we maintain the temperature throughout the application. We must never ignore if the patient is complaining of any discomfort or pain while providing the hot and cold application. We must make sure that the patient must be able to remove the application if it is causing them any discomfort. And if he is not in a condition to be able to remove the application by himself, then we must place a calling bell near the reach of the patient so that if he or she experience this discomfort or pain, they can simply press the bell, for which we will be getting an idea that the patient needs our help. We'll go and attend them, and then we can remove the application. Here we should also make sure that we should never use any electrical appliances near the water or any fluids, because as we will be discussing in our next session about the various appliances that we will be providing to the patient in order to provide the hot or the cold application. So here it is very important that we must instruct the patient not to use the electrical appliances near the water or any other fluids, as well as we must tell them not to touch the appliances with their wet hands. Because as we know that water is a good conductor of electricity, then if one touches the appliances with their wet hands, then it can also lead to shock. Here, not only that, but as a nurse, you must also observe if there is any signs of complication, so that the procedure can be stopped as well as reported immediately. And after the procedure, we must also make sure that we gently pat the body area and not rub it in order to remove the moisture. During the cold applications, we should protect the patient from getting chills. So here, even though if it is required to provide a cold application to the patient, we as a nurse should make sure that it should not lead them to have chills. Because if a person starts having chills, then he or she will start shivering, and this can lead to an increase in the temperature. And in case if you encounter certain patients who is having hypothermia, which is an increased body temperature, as a nurse, you can provide the cold application in order to reduce the temperature. However, you must keep in mind that the temperature of the body should be brought down gradually as well as steadily, because here sudden cooling can be dangerous for the patient. These are the principles that you must follow, as well as you must keep in mind before you provide the hot and cold application to the patient. Since we have understood the hot and cold application, where the application of an agent which is warmer than the skin is known as the hot application, whereas the application of an agent that is cooler than the skin is known as the cold application. Here, depending on the condition of the patient, we will be choosing which application to provide. Because here both the cold and the hot application has its own therapeutic use. So in order to get a clear idea of it, let us now discuss about the therapeutic use of both the hot as well as the cold application. Here, as we know that application of heat causes the peripheral vasodilation. So here, if a person is having pain which is caused due to decreased blood supply, by providing this heat application, it would help to dilate the peripheral arteries, which would increase the blood supply and ultimately relieve the presence of pain. And as we also know, whereas when we talk about the cold application, as we know that cold causes vasoconstriction. So here, by providing the cold application, it can help decrease bleeding as well as control hemorrhage. So here, the main difference between these is that by providing the heat application, it will cause vasodilation, whereas by providing the cold application, it will cause the vasoconstriction. The second therapeutic use is related to the capillary permeability. So by providing this heat application, it would help to increase the capillary permeability, which would lead to an increased blood supply and would relieve the presence of pain if it is caused because of congestion. Whereas when we talk about the cold application, then here by providing the cold application, it would help to decrease the capillary permeability, which would lead to a decreased blood supply and induce edema. The third is about the cellular metabolism. Here, by providing the heat application, it would increase the cellular metabolism, whereas by providing the cold application, it would reduce or it would decrease the cellular metabolism, which would decrease the effect of tissue anoxia and thus necrosis. The next is about the relaxation of the muscles. Here, by providing the hot application, it would help to relax the muscles. By relaxing the muscles, it would help to reduce the presence of pain, which is mainly caused due to muscle spasm or even stiffness. So here, if there is presence of muscle stiffness or muscle spasm, then because of the relaxation of the muscles, which would happen by providing the cold application, it would help to relieve the presence of pain. However, in the cold application, here even if we provide the cold application, it would help to relax the muscles, but here the muscles will only be relaxed by decreasing the muscles contractility. And in inflammation, by providing the heat application, it would help to increase the blood flow towards that inflamed area in order to bring the phagocytes to promote healing. Whereas in that inflamed area, if a cold application has been provided, whereas in cold application, it would help to reduce the effect of burns on the tissues and also decrease the inflammation. Heat application can also be given in order to decrease pain by relaxing the muscles, whereas the cold application can be given to reduce pain by numbing the area as well as by increasing the pain threshold. This heat application has a sedative effect, whereby the cold application has a local anesthetic effect. This heat application can reduce the joint stiffness by decreasing the viscosity of the synovial fluid, whereas the cold application can be provided in order to decrease bleeding. This heat application, from the name itself, you can understand that it is given to provide warmth, whereas the cold application, again, from the name itself, you can understand that it is given to cool the surface area of the body, as well as it would help to reduce the temperature of the body, which is why if a person is having fever, then providing a cold application is a must in order to reduce the body temperature. This heat application also helps to stimulate the peristalsis as well as to relieve constipation. It also helps to soften the exudates. So these are the therapeutic use of both the hot as well as the cold application. I hope till here you have got a clear understanding of what are the principles as well as the therapeutic use. Now let us discuss about the temperature. Here, depending on the condition of the patient, you will be providing the hot and the cold application. So here, in order to get a correct outcome, an appropriate temperature must be set and provided. Here, if a cold application must be provided in order to decrease the body temperature, then we can do it by providing the cold packs, whereby the temperature of the cold pack must be between 15 to 18 degrees Celsius or 59 to 63 degree Fahrenheit. Whereas if the description is cool, then we can provide it through the cool compress, whereby the temperature must be between 18 to 27 degree Celsius or between 65 to 80 degree Fahrenheit. If the description is tepid, then we can provide it through the tepid sponge bath, and this is mainly provided for the patients who are having fever in order to reduce the body temperature. So here this can be provided in a temperature between 27 to 37 degrees Celsius or even between 80 to 90 degree Fahrenheit. Whereas if the description is warm, then we can provide it through the warm water bath or by the use of an aquathermia bath, whereby the temperature must be between 37 to 40 degrees Celsius or even between 98 to 105 degree Fahrenheit. Whereas if the description is hot, then we can provide it through the hot soaks, the irrigations, or even the hot compresses, where the temperature must be between 40 to 46 degrees Celsius or 105 to 115 degree Fahrenheit. Whereas if the description is very hot, then we can provide the hot water bath, where the temperature of the water inside this hot water bath must be above 46 degrees Celsius or above 115 degree Fahrenheit. So here, depending on the description, which is the cold, cool, tepid, warm, hot as well as very hot, we will be deciding which application is to be provided, as well as we must fix the temperature for each and every application. So here, if a cold application is to be provided, we can provide it by the use of an ice bag or through the cold compress. Whereas if the hot application is to be provided, then we can use the hot water bag, the aquathermia pads, or even the hot irrigations. So depending on the condition of the patient, as well as depending on the physician's order, we must provide the hot or the cold application as ordered. I will be concluding this topic for now, whereby in today's session, we have discussed about the principles, the therapeutic use, as well as the temperature of hot and cold application. So I'll be meeting you in my next session, whereby we will be dealing about the various types of hot and cold application in detail. So until then, have a good day. Thank you.